Boston University Orthopaedics is one of the strongest orthopedic surgery residencies in the country. Not only do you get an excellent education, but you also become part of a family that helps provide the care for the patients of Boston.
One strength that stands out in my mind is the diversity of our patient population. We have a large number of homeless or uninsured patients. Maybe they are non-English speaking as their primary language. Maybe they have drug abuse problems. This adds an extra layer of complexity to providing care for their orthopedic issue. It's very rewarding. I think it'll prepare me very well for whatever practice setting I might find myself in the future, whether it be an urban or suburban setting, more academic or private practice. I'll have my patients to thank for being well prepared. The other thing that is worth noting is that we try to provide appropriate, definitive management upon our patient's first presentation in the emergency department, because we never know whether or not they'll have the means to follow up. So we pay great attention, for example, to fracture reduction and appropriate immobilization. That way our patients are not negatively affected if they're not able to make it back to our clinic or to the OR. I think there's real value in noting that residency, anywhere you go, the experience will be what you make of it. You'll get out what you put into it. And at Boston University, you have the opportunity to put a lot in. We are a very hardworking program. You dig your heels in at the beginning of 5 years, work alongside some great people, make good friends. And by the end of it, I hope that I come out fearless in the face of any patient problem. Not that I'll have seen all patient problems, but I'll have an algorithm and principle-based approach to managing their problems. And I think that's a real benefit of our program.
One of the main benefits of our residency program is the broad exposure that we get across multiple institutions. Boston Medical Center is the main teaching hospital of our residency program, which is an academic tertiary care safety net trauma hospital where we get a broad exposure to complex pathology in multiple specialties. We also spend time at Leahy Clinic, which is a new level 1 trauma center where we get further training in the subspecialties. This provides an experience in a more community type setting and a mentorship model. For our pediatric training, we spend time at Boston Children's and Shriners Hospital in Springfield. This provides a great experience to multiple types of pediatric pathology. For orthopedic oncology rotation, we get to spend time at Massachusetts General Hospital. During this rotation, we get a broad exposure to multiple types of oncologic pathology and the reconstructions that are associated with this. We spend time at the VA hospital where we get further exposure and a great operative autonomy. This rotation is also good because it allows us to give back to the veterans of the nation. I think one of the main strengths of our program is this broad training that we get across multiple institutions. No matter where you want to practice in your career, you'll be prepared to succeed in all these models.
The program does a great job exposing residents to research and education at national conferences. Each year, every class attends a large meeting or course as a group, and it's really something that we all look forward to. The PGY2 class goes to the resident comprehensive fracture course at the OTA meeting, and there's normally a few senior residents also presenting research at this meeting, so it's a big group from BU that goes. The PGY3 class goes to ANA arthroscopy course in Chicago each year, where we learn fundamental and advanced arthroscopy techniques from leaders in that field. The PGY4 class goes to the SAFE course each year, which is the surgical approaches for internal fixation, and finally the chief class goes to the AAOS annual meeting. Not only are these national courses an opportunity to learn from and network with leaders in the field of orthopedics, but it's also really fun to get out of the hospital for a few days with your friends in your class. In addition to these annual trips, residents are encouraged to present original research at national meetings. This is a great reward for taking a project from just a question or idea to completion. The department fully supports residents' travels to these conferences, and resident coverage is always arranged for clinical responsibilities.
Second year of ortho residency is arguably the toughest year at pretty much every program, but something that's really helped me get through the most challenging rotations this year has been the mentorship from my more senior co-residents. Our night float rotation has a 2 and a 3 taking in-house call together, so every consult the 2 sees, they go over it with the 3 to make sure that they have an appropriate treatment plan in place. Our short tele rotation is our trauma rotation, so it has a 2 seeing consults throughout the day, and then a 3 and a 5 in the clinic or the OR. So every consult the 2 sees is run by the 3 and or the 5. They can discuss treatment options and go over appropriate literature so the 2 can present the consults in the morning. Weekend call is another way that we get involved in resident mentorship because the intern's paired with a 3 or a 4, and that's a good way for them to get introduced to consult basics. One of my favorite things about our program is how willing everyone is to go above and beyond to help each other. There were multiple times during my second year where my assigned senior wasn't available, but there were always residents who were around to help me, whether they were coming straight from clinic or they were a chief in between their cases, and they were able to meet me in the trauma bay to help deal with a particularly challenging polytrauma patient. Our program will make you work insanely hard, but you're never without the support of your co-residents, and the challenges are what bring us closer together.
I think one of the greatest strengths of our program is the residents and how well we all work together and get along. It's something I noticed right away when I was rotating as a med student, and it certainly held true for the year that I've been here. We're a pretty diverse group. We have people from the Northeast New England area, some from the West Coast, and a few from the Midwest. And about half of us are married, and I think a quarter of us have kids. But despite all our differences, we come together really well as a group, and we have a great culture of helping each other out. And one of the best pieces of advice that I got as a student was that, you can get great training no matter where you go, but having great co-residents is really what makes the biggest difference in how you experience residency and get through the process. And I think you really get that here. Not only will you get a top-notch education, but you'll make great friends and also become a part of an amazing alumni network.
I grew up in Swampscott, Massachusetts. It was about 15 miles north of Boston, and since college I've been living around Boston. I think the one thing I love being a resident in Boston is all the neighborhoods that you can live in and experience as a resident when you have your free time. These include the North End, the South End, South Boston, Beacon Hill. I've lived in 2 different neighborhoods during my time as a resident, and have enjoyed both immensely. It provides opportunities whether you're single, whether you have a family. There's different housing options in different neighborhoods that appeal to different age groups and kind of interests. Especially if you're interested in outdoor activities, there's a lot of green spaces within the city, and also within a 30-minute drive you can get to some great hikes and also great beaches. I think also if you're a winter sports person, living in Boston, you have pretty close access to ski mountains during the winter as well. I'd be remiss not to mention Boston sports. As a Red Sox fan, Patriots fan, a Bruins fan, and Celtics fan, all these events are within the city. And I think that's one of the biggest benefits of Boston is the small geographical space. It makes it a really amenable city to walking around for about 6 to 7 months a year when it's really nice out. These are the things that I love about Boston and living here, and it's a great place to be as a resident.
Being a Boston University orthopedic surgery resident is a lot of hard work, but that hard work is rewarded with a complete understanding of orthopedics, the ability to handle any clinical situation, and finally, you become part of an extensive alumni network dedicated to providing excellent care to all of our patients. Thank you again, and we hope you take the time to consider becoming part of the Boston University orthopedic surgery family.